Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us once again. Now, what happens when the medications we depend on to treat chronic conditions no longer work for us the way that they should? Now, this was the case for Miami resident Darren-Davis Kandler, who was diagnosed in 2012 with Parkinson's disease. He's here joining us with his doctor, Dr. Jagid, and they're going to talk about a recently FDA-approved treatment for Parkinson's. Welcome to the program, both Darren and Dr. Jonathan Jagid. How are you both?
Great, thank you.
Great.
Well, Dr. Jagid, a bit about your background. You are associate professor there at the University of Miami. Other than that, what's a bit about your background, a bit of your background for us?
Right. So, I've been at the University of Miami for a number of years now. I practice neurosurgery. I subspecialize in what's called functional neurosurgery, and I take a lot of pride in treating patients with movement disorders, particularly those suffering with Parkinson's disease. I've had the pleasure over the last 15 years of using this therapy, deep brain stimulation, and I've really had the pleasure of seeing profound improvements in quality of life in that subset of patients. And it's one of the few surgeries in neurosurgery that I think produces consistent results and really impacts people's lives in a positive way.
Darren, a bit about yourself and your diagnosis with Parkinson's. How did that come about? What were you doing? What do you do?
Well, I don't do much. I'm doing other things, small things that I can do, because I'm still trying to get back on my feet after being, kicked down, literally, by this disease. Actually, I am a U.S. veteran, and I was working as a diplomatic security person in Iraq in 2008. That's when the symptoms started, actually. But I came back to the mainland and I got checked up, and they said, nope, nothing's wrong with you. You have PTSD. They gave me some medication, went back. Symptoms died out, came back 6 months later. By that time, in the middle part of 2011, 2012 came around. After seeing a million different doctors, both overseas and in the U.S., and everybody kept misdiagnosing me. By the end of 2012, I was diagnosed with Parkinson. Then 2013, I was in a hospital in Germany for a week. They started the trial medication, came up here to met with Dr. 2013, 2014, 2015, I met with Dr. Jagid. And they said, give it some more time, because I was taking medication, but not that much, as much as I ended up taking last year. And then 3 years passed, I came back and saw them in 2018. And they said, it's about that time. We scheduled an appointment. And then the surgery was in August of 2018, DBS surgery. And from that point on, like I said, the whole point of this particular surgery and treatment therapy is to control the symptoms and to have a better quality of life and feel independent, and also to get rid of these medications, taking medication. I went from taking 24 to taking 4.5 pills daily.
Wow. I
was trying to get it even further down.
That's profound. Dr. Jagid, Darren was talking about his symptoms starting in 2008, 2009. What are the symptoms of Parkinson's?
Right. So Parkinson's disease, right, is one of the most common neurodegenerative disorders we deal with in medicine, and it's actually very common. If you look at the statistics, 1 million people in the United States at any given time are suffering with Parkinson's disease, 10 million people worldwide. So this is a very common disorder, all right? And this disorder really affects patients in terms of their movement, right? A lot of the things that we take for granted when we're going about our daily routines, these patients can't do. They have slowness of movement, inability to move, meaning they can actually freeze at times. They have profound tremors, sometimes very violent tremors, difficulty with walking, rigidity of their muscles, all of which, when combined, really profoundly, cause your quality of life to deteriorate. Initially and historically, we treat patients with medication, and the medications actually work very well initially, as Darren described. But as he also described, as time goes by, and typically, in about 4 or 5 years of your disease, you find yourself taking an overwhelming amount of medication. You find yourself taking it more frequently throughout the day, and that's because the medication starts to have less of an effect, and you find that your quality of life continues to deteriorate. And at the same time, because you're taking this medication over so many years, you start to develop complications related to the medication itself, which also have a profound negative impact on your quality of life. And so what we're talking about here today is deep brain stimulation, right? This is a piece of technology. DBS is what we refer to it as. This is a piece of technology that's fully FDA approved. It's actually been around for a number of years. And this particular device, which is very similar to a pacemaker, which can be implanted in a relatively minimally invasive type of way, can have a profound effect on your quality of life. It doesn't work for everybody with Parkinson's disease. It's important to, make that clear. You need to be seen by a specialist. You need to make sure that your symptoms are the symptoms that would improve with this therapy. But if it is, and you are a candidate, this can have a profound positive impact on your quality of life, like Darren mentioned, in addition to allowing you to substantially reduce your medication. In Darren's case, we implanted a Boston Scientific Vercise deep brain stimulation system, which is one of the newer devices on the market. And this device has really sort of pushed the technology forward to the extent that it's miniaturized a lot of the hardware. So from a patient's perspective, aesthetically very appealing, and likewise has also improved the way we deliver stimulation, allowing us to not only stimulate circumferentially, but have directional stimulation. And so this is a major advance.
Well, where can our listeners go and learn more and maybe get some training and lots more information about the device and about the surgery?
Yes, they can go to dbsandme.com. That is Deep Brain Stimulation and me.com. Resource set up by Boston Scientific that can provide information about DBS and Parkinson's disease.
Great.
dbsandme.com.
Great. Well, thank you both. Darren and Dr. Jagid, it's been a pleasure talking to both of you, and I'm wishing you both the best. Thank you for joining us today.
Thank you so much.
You're welcome. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.